Hey everyone, and welcome to another episode of the Aesthetic Edge, the podcast where we go behind the scenes with med spa owners, founders, providers, and aesthetic innovators who are pushing the industry forward. I am your host, Bethany Gifford, and today I have the honor of speaking with someone whose name holds real weight in both the surgical and aesthetic world, Dr. Soheila Rostami. But first, a word from our sponsor.
This episode is brought to you by New Era Intel. At New Era Intel, we help medical spas, dermatology clinics, and plastic surgery practices who are struggling with inconsistent patient retention, underutilized CRM systems, and manual systems that hold back your clinic's growth potential so they can finally increase quality repeat bookings, streamline operations with AI automation, and grow predictable monthly revenue with the right systems and strategy. They're able to create a premium, seamless patient experience while freeing up their team to focus on what they do best. If you would like to take your business to the next level, head over to neweraintel.com to get started.
Dr. Rostami is a double board certified ocular, facial, plastic, and facial cosmetic surgeon and the founder of two successful practices in Northern Virginia, Sanctuary Cosmetic Center and Rostami Ophthalmic Plastic Consultants. With over 2 decades of experience, she earned reputation for blending surgical precision with true artistry, giving patients results that are both refined and natural. She is also a trailblazer in education and mentorship, having launched an accredited fellowship program in 2019. From operating rooms to training rooms, Dr. Rostami is raising the bar for safety, outcome, and the patient experience. Welcome to the show, Dr. Rostami.
Thank you for having me.
Okay, so let's start from the beginning. What drew you to facial cosmetic and reconstructive surgery, and what's keeping you passionate about it?
Since I was a little girl, I always wanted to be a surgeon. So that was no question. Everybody in my family, they knew Soheila is going to be a surgeon. But when I went through training in med school, then you get exposed to different types of surgery. And from the beginning, I was very passionate about ocular area. I think Da Vinci said it, the window to the soul is through your eyes, and I really believe in that. And everybody, as soon as they see you, the first thing they look at you is your eyes. You know, everybody connect with one another through their eyes. And that always been something that intrigued me. And I really didn't want to be a cataract surgeon. So the reason I went to ophthalmology was because of oculofacial plastic. So from day one, everybody, and even during my interview, I specifically told them that's the reason I'm picking ophthalmology. So my chairman knew that, and so I usually had majority of the cases that I was doing were related to oculofacial plastic. And then I did my fellowship. I did um, much, and it's so funny how somebody who is like me in that period, so many things was happening in cosmetic world. And, as an oculofacial plastic surgeon in 2000, Botox, which was used in ophthalmology more than any other specialty for, blepharospasm and hemifacial spasms, and curators, Dr. Curator, ophthalmologist, and Dr. Curator, husband, was a PharmD. They created the cosmetic Botox at that time. And that was, and we all knew it. If you were part of the ophthalmology group, you knew that the people who had hemifacial spasm, the side that you were doing the neurotoxin injections or Botox injection, at that time we used to call it botulinum. So the botulinum injection looked much younger than the other side. And so this is how they came about with it. And so I was very intrigued. And as a resident, we used to do injection for each other for cosmetic, and it wasn't even approved for cosmetic procedures at that time. And then it was approved in 2000 for cosmetic use. And we were all so excited. And that's the reason I kind of started with the whole industrial changes toward cosmetic. So then in 2002, Restylane came up with the first HA filler. Before that was collagen, and you had to do a skin test and all kind of things. So I wasn't so interested in that. But as soon as the Restylane HA came out, then it was totally a different ball game. And also, Luminous came out with the first IPL, and CO2 laser came around. And when I was doing my fellowship, I got introduced to CO2 laser surgery and laser resurfacing. And there were a bunch of doctors at University of Maryland that were offering the resurfacing, but you could use it for cutting for surgical use as well. So you can see that it was very intimate. It was my practice training and the cosmetic were coming together naturally. And so that's the reason I became more interested in cosmetic, but I was doing a lot of reconstructive surgery at the beginning of my career. But not many people were doing any that kind of like just cosmetic from oculofacial plastic surgeons. So I think I was one of the pioneers of oculofacial plastic surgeons starting cosmetic procedures. And I was lucky to be trained for facelift during my fellowship. So when I came out of the fellowship, I was doing facelift as well. And so combining the facelift with fillers, with neurotoxins, were just a natural thing to do. So that's how it became
That's
how
amazing.
I created my practices.
Such a fascinating history, where everything came from and how it's kind of evolved into where it is now. That's amazing. I love that. Well, you have
Yes.
built two very successful practices. Can you share a little bit about the journey of launching Sanctuary Cosmetic Center back in 2015 and what the process looked like for
Yes,
you?
Sanctuary is well, I have to say the Rostami OPC is my baby, the original baby, but my golden baby is Sanctuary Cosmetic Center. So I created a Sanctuary Cosmetic Center after 5 years of a lot of research, going to many different practices in New York, in Miami, in California, and even outside US, in France, um, and also, I'm from Iran, so some of the neighbors, so I visited Turkey and Dubai. And so I did a lot of research trying to come up with something that would work in Northern Virginia. And so we opened the doors in 2015 in Sanctuary in Tysons, Virginia. And I believe that we've done a great job with providing a sanctuary, what the name is, for cosmetic procedures. We really try to make sure everything that we do is done by experts and in the right way.
I was going to ask you where you came up with the name Sanctuary, so that's amazing. I love that.
That's how.
All intertwined. Well, in 2019, you launched a 1-year accredited cosmetic surgery fellowship, which is such a powerful legacy move. What decided you to take that step?
I've been involved with American Academy of Cosmetic Surgery and American Board of Cosmetic Surgery for a while, and I really respect them. I believe that, like any other specialty, this cosmetic surgery and in cosmetic industry is a new development in surgical procedures, and I really believe that you need to have training other than your basic training in surgery. So uh, that's the reason I have created the fellowship, and I wanted to participate with the fellowship programs, because really surgical procedures that we do is different than the reconstructive surgery in cosmetic surgery. So a lot of fellow trained or resident trained in programs that go through hospitals, they really don't get the chance to be able to do cosmetic procedures. The reason is because a lot of the cosmetic procedures are done outside the hospital. And the fellows and residents, they go through hospital training. So they do see a lot of reconstructive procedures, but not that many people really experience the cosmetic surgeries. And I really believe that there are so many changes has happened, that combination of fillers, neurotoxins, lasers, RF technology needs to be combined together to give the right outcome for surgical procedures for cosmetics. And so that needs to be a different training. And so truly, I believe that the fellowship training should be separated.
That's awesome. How do you approach mentorship with physicians, especially women who want to lead in the space?
Um, it is kind of when you do interview for fellowship individuals, you have to kind of make sure that the personalities match, and they understand what's expected from them. So forgive me for the ring.
Okay.
So I try to make sure they understand what's the expectation in the program, and make sure that I do the right job for them and train them in an appropriate way. So they are with me almost every minute during the day when I'm doing surgery, and we do have another surgeon. Um, Actually, we have two other surgeons that they will have chance to spend time with. So it won't be just one individual teaching them. There will be multiple people teaching them different way of approaching cosmetic procedures.
That's interesting. Wow. I can't imagine the surgeons out there that are having the opportunity to work with you in this field. They are very fortunate.
Thank you. I
Yeah,
appreciate that. Thank you.
that's amazing. Well, you're constantly innovating, from surgical techniques to practice philosophy. Are there any trends or procedures that you are particularly excited about right now?
There are some really amazing things that are coming around, and I'm sure a lot of patients, they hear about gene treatments for aging and those kind of like more stem cell research and more
Mhm.
of getting back to the original cause of aging. So I'm very excited to hear more of the things that can change the aging from cellular level, not so much from appearance, but more of a cellular level. And there are so much going on right now with those kind of studies coming out. And believe it or not, US is not the uh, forefront. South Korea and Japan and China are unfortunately taking over us. And they're becoming more of a forefront, considering the stem cell and cellular aging process and changing that. So I'm waiting to hear a little bit more of the progression that is happening in that field.
We've heard a lot of it. A lot of our clients and the people that I've had the opportunity to interview are really getting excited about this whole biohacking, stem cell, longevity, peptides. They're really getting into the healthier version of medicine and
Yes, there
cosmetics,
are some, exactly. There are some amazing things happening, and I really think that we are at the uh, earliest stages of aging, facial aesthetic aging and body aesthetic aging. I think that we will see some serious development in that field of aesthetic from the aging perspective and anti-aging as perspective.
Absolutely. We have resumed the show. We needed to take a quick break. We're back with Dr. Rostami, and we're talking about her balance between both a high performing surgeon and an educator. How do you handle that without burning out?
And being a mother too.
Oh,
We forgot that part.
trifecta.
Yeah. The reason I brought that up because honestly, a lot of people don't recognize female surgeons are really have a rough time dealing with having children, having a career, and also being a teacher. So these are all the combination are very complicated, and uh, it's not a easy. That's one thing I have to say I never felt being different than a male surgeon. That was the only thing that I felt different, that I had the obligation to the children, and I had to deal with my career as well as the children. So that dichotomy and that difficulty is also there. But as a teacher, I feel like actually it gives you more ability to be better version of yourself. Always being a teacher teaches you more than you're teaching them. And I really believe that. And that's why I like to teach, because I feel like I learn more from teaching than this, the fellows are learning. I learn how to be a better human being, better surgeon, in all aspects.
That's amazing. I love that. Yeah, education is a gift in itself.
Yes,
Hey,
but it
well,
makes you humble, honestly.
100%. Yeah. I always like to know that when I'm teaching someone else, you learn from it as well. So you're learning as you go. I love that. All right. Let's switch gears a little bit and let's talk about business building. What has worked best for your growing patient base? Basically, word of mouth, patient referrals, online education.
A combination of all of the things you mentioned is important. But what I really learned, actually, yesterday we had our board meeting, and I found out one of our very successful individual had to give up their certificate. And it's because, when you try to do too much at once, you can cause problems. And that's one lesson I wanted to teach. If I teach anything in my business, is that try to be true to yourself and try to be honest with your patients. Those are the two things that makes you successful. Money should not be your goal. Money will come with it. It's you being true to yourself and to your patients. And that will get you to be successful.
One of my mentors always told me money is a renewable resource, but integrity is not.
Yes, I believe that. And I really think that patients realize that and they can see it in you. If you try to sell things to people, people will recognize that. And they're not
People
going
can
to
see it.
fall for it. Maybe they fall for it once, they won't fall for it twice. So you
100%.
have to really want their best, be true to them and to yourself and to your capability.
Has that changed the way that you market yourself or handle the marketing strategy?
It has not changed because I'm always true to myself. But yes, I always stick to this rule. I don't like to false advertise. I don't like to sell myself because you have to also understand you're a surgeon, you're not a salesperson. So you have to really respect your profession. You are a surgeon before anything else. So you have to respect that, and there is some value to that, and separate yourself from a salesperson. So these are the things that I really think that makes a difference in being a true marketing, because it comes true. If you have a skill and people understand it, they want to hear from you. They wanted you to provide for them. And that's important. That's a
Love that.
great marketing tool, don't you think?
Absolutely. It's the best there is.
That's it.
Absolutely. I love that. Well, what does success look like for you in the next 6 to 12 months, either personally or with Sanctuary?
Well, I'm getting to the point of my life that I'm thinking of starting to kind of slow down. So my goal is within the next 12 months, or actually maybe 2, 3 years, try to find the right person to replace me
Oh,
and
that's going to be
possibly
hard.
little by little retire.
That's going to be hard to be able to replace you for sure.
I don't know about that. I mean, I always say, you think that no, you're not replaceable. You're always replaceable, no matter how good you are.
That'll just be a testament to all the students that you're teaching.
Yes, yes, yes. Actually, um, one of them is staying with me, and I'm very excited, and he's joining me. So I'm very happy that he
Wonderful.
decided to join our practice.
That's amazing. Are there any areas of your practice that you're doubling down on right now, whether it's internal systems, or your training, technology, or something else?
Technology wise, we always try to be updated. That's something that I've told my staff from day one, that we want to make sure we provide the most updated but reliable technology. So we really do that on a routine basis. Now, considering what is our focus right now is to really expand possibly uh, one of the services we provide, and or we adding to it. So the fellow that is joining us is an oral maxillary facial surgeon. That is so
Mm,
different than what I provide. So that's something that we are focusing on. We're trying to help him as soon as he starts to expand his needs. So that would be our focus for the next few months.
that's excellent. Yeah, you guys have built something very sustainable, and
Thank you.
that's going to be amazing to have that addition for you.
Thank you.
What advice would you give other providers or practice owners who are trying to scale without losing, that core value and feel that you've created?
Unfortunately, I've noticed a lot of spas and med spas around focus on technology and not so much on their own skills, which
Mm.
should be opposite. It should be focused on your skill and then technology. Unfortunately, they're missing that. They're putting technology before their skills. Even the technology needs your skills to be able to be successful. And that's my goal, my 2 cents. I would tell them, rely on your skills before you rely on technology, and make sure that you know what you're providing for the patients
That's so
and
huge in
clients.
the days of AI, because the company that I founded, the New Era Intel, also uses a lot of AI automation, but that does not replace, HI, which is human interaction. You have to have your skills match and mix with what you're doing technology wise, for sure.
Yes, exactly. That's why sometimes when you look at it now, the AI, they rely on the AI so much that
Mm.
sometimes you see that nothing makes sense And you know that they didn't do anything with it.
I know. Yeah.
Yeah.
Yeah, we do a lot of consulting with med spas and practices, dermatology and plastics as well. And they're always nervous. They're like, "Are you just going to implement a program?" I'm like, "No, we're implementing a person, an actual face, an actual
Yes.
voice, somebody with experience." So I think that's
Yes.
amazing. Well, Dr. Rostami, thank you so much for sharing your story and your insight and your journey. It's such a powerful example of what's possible in aesthetic medicine when leadership and your legacy, is all part of the equation. So thank you so
And it was
much.
a pleasure
Before we
talking.
wrap up, can you let our listeners know where they can find you, learn more about Sanctuary, or connect with your fellowship program?
Yes. Our practice is in Northern Virginia. We have two websites, sanctuarycosmeticcenter.com and for beauty and then number 4i.com, which is beauty4i.com. My Instagram handle is beauty by Dr. Rostami, and they can connect with me and send me messages if they like. Thank you so much, Bethany, for doing this with me, and I hope this was helpful for people.
Oh, it's going to be a world of knowledge. I just know this is going to be one of the most popular episodes. Thank you so much. And we look
Thank
forward to
you.
connecting with you again. And I have the privilege of connecting with your Director of Operations, Abdul Khattab, next week to see how we can align our expertise. So I'm looking forward to that as
Thank you.
well. Thank you,
Bye bye.
everybody. And we look forward to having you on the next episode.
Take care.